now's the time when you have the opportunity to ask questions of Amanda and myself. So maybe, Amanda, you could step up if you wouldn't mind. I should say that earlier in the year, a few months ago, I had the pleasure of participating in a community forum with the Minister for Health, and I must say I admired so much the way she handled that and handled the questions. Unfortunately, I'm not a politician, but I have bought some props. So if I hold up my smiley face, that means I don't know the answer, and Amanda's going to answer this one. And if you see my nose growing, you can draw your own conclusions. So seriously, are there any questions that anybody would like to ask? Sure, there must be somebody who has a question.
Can I? There's a fair bit of money available from the feds, I think, at the moment, palliative care. Are we making an effort to get some of that?
Yeah.
Thanks, Jeff. There has, I don't know whether everyone's aware, but there's about $35 million available at the moment for palliative care. Josephine Chow is leading a group with us on the development of a palliative care project, one that we actually piloted I think about a year or two ago, called the Peach Project. We're going to adapt that, and we've actually gone into partnership with Silverchain in terms of putting that proposal together, and we're about, and we will submit, I think it's early in January for that project. So the focus of the project, the focus of the project is about home-based palliative care services, Jeff. So we're really excited to actually pick back up the Peach Project, but also run it in collaboration with an external partner. So we're quite excited about that.
State money.
State money, apologies.
Yes, that's not Commonwealth. It's state
I can give you one assurance. I've worked with Professor Chow in another phase of her life, and her special job out here is to leave no stone unturned. So if there is any money available anywhere, she is going for it, I can assure you. Are there any other questions? Just perhaps have the microphone.
What has been your best achievement this year, in your opinion?
Well, there's so many. I think for me personally, we haven't obviously, this hasn't been a board agenda item. For me personally, it's been the achievements of individual staff and individual groups of staff. I am personally inspired by the work that I see done out here. The quality awards. I mean, getting 6 finalists and getting 2 prizes. I mean, that's just amazing for a local health district. I came to a nurses forum, and I sat and heard a presentation by the NUM of an adolescent health unit, a mental health unit, and how she went in there, and there was considerable behavioural problems occurring in that unit, and she single-handedly set up systems, inspired the staff, and everything just settled down, and that was just amazing. So it's those stories that I hear, those awards that are given. It's the presentations that I find personally inspiring, and I think they are the achievements. It's what our people do. Do you want to add anything?
The thing that I would want to add is the quality of care. The main focus of our business is provision of care to our patients, to families and to carers. I think we have continued to maintain a very high level quality of care with an increasing demand and increasing pressure on our services, and we do that by the commitment of staff, as I said earlier, but also looking consistently at innovative ways about how we will deliver that care. And I think what Phil is reflecting is constantly staff are looking at different ways to do it, but it's the quality of care, and we must never lose sight of that, and I always think that must always be our main achievement.